What is targeted therapy? Targeted therapy is a collective term for all kinds of anti-cancer drugs that inhibit or stop the growth of tumor cells in a targeted way. A targeted therapy can inhibit the signals that allow cancer cells to grow in different ways. That is why these drugs are often called signal inhibitors. These drugs block specific proteins that the cancer cells need to grow. For example, by binding to proteins in or on the cancer cell dies and therefore stops dividing. Other signal inhibitors do not target the cancer cells themselves, but rather their environment. They affect the blood vessels around the tumor, depriving the cancer cells of nutrients and causing them to die. Anti-hormonal therapy is also a targeted therapy that inhibits the production and/or action of the patient's own hormones. Such a treatment is only used if hormones play a role in the growth of the cancer cells. Targeted therapies are therefore prescribed only to patients who present a certain error in their genetic material that can be identified and for which a specific treatment exists. Targeted therapies can be given alone or in combination with other cancer treatments. They are usually administered by mouth in the form of tablets or capsules. Some targeted therapies are also administered via infusion. Oral administration has many advantages, such as the possibility to take your treatment at home, integrate it easily into your daily life, avoid traveling back and forth to the hospital, and being more independent. However, it is essential that you take your treatment exactly as prescribed by your doctor. Only the correct intake of oral cancer medicines guarantees optimal efficacy. Despite the fact that a targeted therapy attacks specific proteins on or in the cancer cells, side effects may also occur. This is because some of these proteins can also be found on or in healthy body cells. A few possible side effects are fatigue, nausea and vomiting, diarrhea, inflammation of the mouth, skin rash, high blood pressure, etc. The type of side effect varies from product to product and from person to person. The severity and frequency of these side effects varies from product to product and often also depends on the dose administered. Do not hesitate to report any side effects so that appropriate treatment can be started. Depending on the severity of the side effects, the dose may need to be reduced. If you have any other questions about this topic, do not hesitate to get in touch with your healthcare providers at the hospital.